Morning, everybody. Rumor has it if you behave yourself, don't ask any questions, you're all going to get some baby Guinness later. So, okay, so I'm going to have a little chat to you about a 12-year-old patient. He attended into clinic with his mum, and they were quite upset because they had been sort of around the houses, as they would call it, and hadn't really been getting anywhere in terms of his pain and managing that. I've kind of given it away what we're going to talk about. It's Accessory Navicular Syndrome. We'll get into the case history in a little bit, but we're going to just chat about what Accessory Navicular Syndrome is first, quickly. Okay, it's fairly uncommon. Now, they would estimate about 10 to 12% of the population would have an accessory navicular bone, and then about 10% of that might present with symptoms. It's typically an insidious onset, most common in adolescence or early adulthood. Diagnosis is a combination of what we see clinically and then obviously x-ray. Treatment is usually conservative. It's just finding the right balance between managing the forces within the foot. Risk factors, obviously there has to be a congenital presence of the accessory navicular bone. Pes plana valgus, it's more common with a flatter foot. Overuse activities, so really active sports, kids, tight-fitting shoes. There can be a history of injury and trauma, but not as common. It's more common in females. We don't know why. I couldn't find anything there. It just says it's more common in women, sorry. And then a family history as well. Pathomechanics. Okay, so what really happens here is that the presence of the accessory bone causes increased stress to the tibialis posterior. That changes the forces along the MLA, which can then lead to chronic irritation, inflammation, weakening of the support structures, and then in adulthood can sort of progress to that flatter foot, or the adult-acquired flat foot that we see. So this was a 12-year-old boy, he came with his mum. He had presented, so before obviously get his shoes off, we have a little chat, what's going on. Mum was a little bit upset because she had been aware of this. She had taken him to GP, he'd been A&E. At no point had anybody done any imaging, right, which I find disappointing. So he presents to the professionals, doesn't get any help. He had been given NSAIDs and he'd been told to RICE protocol. That's all he had had. And that had been going on for 5 years. So what I start to do is start to think about, well, what actually could this be? Okay, so you're thinking it's unilateral, so you're thinking about coalition potential, you're thinking about, well, there could be an avascular necrosis, so a Kohler's. So it's just really trying to figure out, well, what's going on, okay? For him, the pain had been increasing over the past 12 months. He'd give up sport. He wasn't doing anything. He was sitting at home. He, in his mother's words, was becoming quite lazy. But the child himself really had a desire to be out playing sport with his friends, and it just wasn't happening for him. There was no history of trauma, so it was very much an insidious onset. So, as I've said, it was made worse by running, sport, and yeah, so we can tell there's, yeah, rice and NSAIDs. That's all he'd been given. So what we have to then do is sort of help them understand what's this problem, and then how can we help them as a clinical podiatrist conservatively. So what I saw was there's a lot of tenderness around the navicular, redness, swelling. There was quite prominent, so I'm starting to think at this point, okay, well, most likely an accessory navicular. He had bilateral pes plana valgus foot type, so both were flat. He had tightness in the calf muscles. He was telling me that he'd been doing stretching, he'd been given some exercises, he had attended with a physiotherapist via the local health service, but he just wasn't getting anywhere in terms of management of his pain. There was stiffness with Jack's test, and then there was increased supination resistance. He had pain when he was standing, getting up on his tiptoes. There was a lot of pain in that, and he actually just really, really struggled. Dynamically, there was pretty much a gait disturbance, so he's limping because of pain. All right, there was an abduction and a low gear propulsion. I had the benefit of being able to get an x-ray when they were there on the day, which then just showed a little accessory navicular, okay? So that's his foot. So what are we gonna do? All right, so we chat about activity modification. Well, he'd already done that. He wasn't doing anything. He wasn't getting better. He had still a lot of pain. So he'd already modified his activity. I had a good conversation with him about footwear choices. because obviously we want to try and avoid anything that's super tight, anything that's just going to cause a bit of irritation around that navicular. He'd already done his NSAIDs, he'd been doing some strength conditioning, but he just wasn't getting to grips with his pain. So that led on to, as the podiatrist, we're going to start thinking about orthotic therapy. And then obviously down the line, if unfortunately he's not getting better, then we can think about helping him by referring to our surgical colleagues. But he was missing, from what I could see, something in his shoe that can help manage the forces that are presenting at the foot. So what are our aims? This is not exhaustive, by the way. This is just very done. Connor's putting pressure on me. So what we want to do is increase movement through the first MTP. We want to sort of try and promote better function through the big toe. What I did, I like a navicular sweet spot. I think it's really good for just modifying, you know, the forces at that area, particularly when there's an accessory bone. It's not, you can fill it with something super soft, and like kids love it. I put in a little heel lift. That was just to manage some of the tightness from the calf. So orthotic prescription, I went for standard functional. Saw him in the summer, so I've been starting to use a lot of these sustainable 3D printed shells. Got a little sweet spot added in, just at the navicular. On the left side, essentially what I've done with the skive and the rear foot post, and even the poron arch, all I'm trying to do is sort of increase the supination moments of force just to reduce the stress that's happening out of that navicular. You know, just really simple. These are some of the techniques that we can use. Obviously got a little bit greedy and used 3 of them here, but you know, it's really about helping that kid out of where he's at, and that is an inactive 12-year-old boy who just wants to be playing football. Put a little 3mm heel lift on, that bilaterally, and that was just to help take some of the tension away from the calf. The right side, calc vertical, didn't do anything. Yes, it was a flat foot, but he had no symptoms, he had no problems, so it just kept it really, really simple in his case. I have been lucky enough to review him, and he's doing well. He's back playing sport. By no means is he completely pain-free. He's doing his exercises, he's modified his footwear choices. I've told him to avoid barefoot like the plague, so he's running around the house in a pair of UFOs. So I think he argues with his little brother because he tries to wear them too. So, you know, I'm saying, well, have another pair. But anyway, no, he's doing really well, and that's the main thing. But obviously, we just have to use all the tools that are available to us to try and help that kid. All right, Sarah, thank you.